And this is my brief introduction video for those of you who are taking my telephone triage training class. During this class, you're going to be defining telephone triage, figuring out what the practice settings are going to be for your telephone triage, who the primary population is going to be, summarizing the qualifications of the nurse who's going to be doing the telephone triage, discussing best practices, summarizing the essential aspects of good communication during telephone triage, describing the tools you're going to need for telephone triage, and discussing the common risks that are involved with telephone triage, along with the characteristics of the telephone triage role. According to Briggs, telephone triage is defined as a systematic process in which a nurse screens a caller's symptoms for urgency and advises the caller accordingly. Telephone triage is not a replacement for the advice given by a primary care provider. A telephone triage call cannot be taken by secretaries or other healthcare providers that are not licensed. These providers have to be registered nurses. The initial objective listed in the telephone triage program was to have a general understanding of the definition of telephone triage. Your practice settings are going to be those that are based around the privacy of the patient. You need to be in a secured area utilizing a secured system. All of the documentation can be done mostly online with a secure documentation tool. You can ensure a patient's privacy by making sure that there are no bystanders around during your telephone triage training call. Most of the population that's going to be using this system are those that are searching for healthcare advice, whether for themselves or for a patient or a family member. For the purpose of this training, this is going to be specifically for the organization that I work in, and the people utilizing it are going to be home health and hospice patients. The tools that you're going to be using during this training are not just physical tools, such as a telephone and a computer. They're also going to be the needed clinical skills to determine what is going on with a patient and strong communication skills. We're going to be covering how to use the Briggs Telephone Triage Manual, along with the scope of practice that nurses must adhere to from the American Academy of Ambulatory Care Nursing. There will be discussions, role play, and patient simulation to help you learn the practice of telephone triage in the best way possible.